Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over the MSN Nurse Leadership Administration degree. In this video I'm going to cover what it is, the positions that these people hold, where they work, job duties, educational/job requirements, salaries, and the pros and cons of getting this degree. So what is it? This is a graduate degree for registered nurses who want to work in leadership roles in the healthcare system. Many of these programs are offered 100% online through accredited universities, which is awesome for if you are working, you have children, you can take your time and you can do it completely online and you don't have to go to a physical classroom. Typically, nurses who go back for this type of degree have worked as an RN for a number of years, and they probably already hold some type of management role, or they're thinking about it. Like they're a manager, say they got hired on as a manager over a unit, and one of the job requirements was that they needed to get a master's degree, so they'll work in that job while they're getting the master's degree. But normally this degree is for nurses who have experience in the clinical setting, and they want to go back to either get the credentials or it's a job requirement. Now, what positions are held by nurses who get the MSN Nurse Leadership degree? They're your nurse managers. These are your managers who are over certain units in hospitals. Your chief nursing officers, directors of nursing, department directors, nursing faculty, and nursing service administrators. Okay, where do these individuals work? Well, they work in hospitals, long-term care facilities, healthcare organizations, corporate healthcare organizations, community clinics, and managed care firms, which I'll be going over a managed care nurse next. Okay, what are their job duties? What do they do? Well, they do a wide variety of things, and it depends on if you're a nurse manager or you're a chief nursing officer, but this is usually the highlight, but it can vary. Okay, they supervise nursing staff, ensure budgets are balanced correctly, deal with patient complaints or some tragic event that's happened. They develop and implement nursing policies. They deal with payroll. They ensure staff follow state regulations and standards. They develop strategies to improve patient care. They staff units appropriately, make sure that there's enough nurses, a secretary, CNA, and they hire and terminate employees. Okay, what are the educational requirements and job requirements typically to hold a position in nurse leadership? Number one, they have to be a nurse with a bachelor's degree. And you get a bachelor's degree and then you go on for a master's degree, a MSN. And you do this through a program that is specifically offering a master's degree in nursing leadership and administration. And this typically takes 2 years, give or take how fast you get it done. Positions who hire for these type of positions, from what I've seen in personal experiences working in the hospital with managers, normally what happens is that a nurse will start out with a BSN working as a floor nurse, as a bedside nurse. Then they may take like a charge nurse position, and then an assistant manager position may open up, or a manager over a unit may open up. So the nurse will take that. But generally they will work in this setting for a while as a nurse, probably like from 3 anywhere up to 10 years. Some nurse managers or chief nursing officers have been bedside nurses or nurses for a long time. These positions are not normally held by new nurse graduates unless that new nurse graduate is coming in with like an extensive background in management. This is maybe like their 2nd or 3rd degree and they're being hired on that. But that's usually not the case. The people who are holding these positions are very experienced nurses with management experience. Okay, salary. This totally depends on the position you take. It varies. But let me throw some salary figures out there for you just to give you an idea. Nurse managers, all these are according to payscale.com, by the way, it's a source. They average about $81,000 per year, and so do directors of nursing. The biggest earners out of this whole degree is the Chief Nursing Officers, your CNOs, coming in at $119,000. So that was that. That takes all these managers together, takes their averages, regardless of years, experience, geographical locations, which can impact salary. So that was just an average. Now let's look at the pros and the cons. As with anything, there are pros and there are cons. Okay, pros. A lot reported that they love using creativity into solving problems. They're just creative people and they love doing that. And they like making patient outcomes better. Maybe they've came in, a process isn't working for patients, outcomes aren't good, and they can use that creativity and make it better, so they love being in that type of role. And the higher wages, of course, compared to a bedside nurse, and room for advancement. Because as we looked back in the salary information, the CNOs make about $119,000, so there's room to move. You can get higher paying jobs. Okay, cons. A lot of people reported that they miss the patient interaction and using their nursing clinical skills because, you know, as a bedside nurse, that's what you're doing a lot, and in this position, you're not. Next, a lot of people reported a lot of high stress. You're having to meet deadlines, you're dealing with disgruntled employees, there's a lot of stress on you because you have a lot of responsibilities. And they typically work long hours, although, you know, you hear they work Monday through Friday. Typically some will work the weekends, and it comes back to the next point. A lot of them are on call 24/7, 7 days a week, even on holidays, just in case someone has to get a hold of them. So it's really hard to balance their personal life and their work life. So those were some of the pros and cons. Okay, so that was a little bit about the MSN Nursing Leadership Administration degree. I hope that helped you out. Be sure to check out my other nursing specialty videos, and thank you so much for watching, and please consider subscribing to this YouTube channel.